This is Dr. Dave Seftel for Macular News reporting from ARVO 2014. We're here with Dr. Mary Aronow. First of all, tell us about your affiliation and your responsibilities at the NEI.
Well, I'm a clinical fellow in medical retina at the National Eye Institute, and I see patients with a number of conditions, including macular degeneration, diabetic retinopathy, retinal degenerations, really any problem involving the eye.
And how long have you been in that particular position at the NEI?
I've been at the NEI for a year now.
So tell us about the work that you presented here today at ARVO.
This morning I gave a presentation about aspirin and age-related macular degeneration, and particularly looking at our series of patients who were in the age-related eye disease study 2. There's been a concern recently that there's an increased risk of hemorrhagic AMD in patients who are taking aspirin. And there's a discrepancy if you look at population-based studies and clinic-based studies regarding these results. And so we looked at patients who were enrolled in the AREDS 2 study and found that really there was no increased risk among aspirin users and non-aspirin users in the development of neovascular AMD or any late geographic atrophy.
It's very interesting that you mentioned that, because clearly some initial studies raised concern about aspirin, and there have been some other papers presented here at the conference talking about aspirin-induced apoptosis. Now, your review has shown that at a clinical level, this does not appear to have an adverse effect. Is that correct?
That's correct.
What are some of the next steps that you're looking at? Are you going to be continuing to look at this issue, or is this issue closed from your perspective at this time?
I think it's an important issue. Many of our patients are older and they're on aspirin for very important medical reasons, and they need to be on aspirin. And each study that has looked at this issue has been flawed in some way. And the purpose of looking at the AREDS 2 data was to look at a randomized controlled trial. I think it's very important to do this, and in the future we will continue to keep looking. I think that we've shed some light on the answer to this question, and we feel pretty comfortable, but really we need to do a randomized controlled trial that is designed to look at this issue.
Well, that should be welcome news for the millions of people who have to take aspirin and should be taking aspirin for cardiovascular prevention, for the prevention of colon cancer, and prevention of stroke. Tell us about some of the other work that you're working on currently.
I'm looking at patients who have von Hippel-Lindau disease, and we're looking for other therapies for these patients. They have eye tumors and have a significant morbidity in terms of their impact on visual acuity. And we have many therapies for patients with von Hippel-Lindau disease, including thermal laser, cryotherapy, surgery. However, there just aren't good therapies for some patients who have advanced tumors, and so we're looking for alternative therapies such as intraocular injections of medications and so forth.
Now, over the last 10 to 20 years, the NEI has significantly increased the amount of grants that it gives to macular degeneration. And I speak about it because I've been with the Macular Foundation for almost 20 years, and we've seen this and we've been very gratified with the grant making. Is this a continuous plan to try to increase funding?
You should attend Paul Sieving's talk relating to the audacious goals of the National Eye Institute. Yes, we are certainly interested in that.
And as you see your division going forward, what are the priorities in your mind in terms of research direction?
Right. I think we need to focus both on preventative therapies. Preventative medicine is a huge area, and we need to do that in terms of eye disease, particularly with diabetic retinopathy. We need to be better at recognizing diabetes early rather than treating at a late stage. And with macular degeneration, if we can do the same thing, that would be wonderful, and I think we've made some headway there. I think we also need better therapies once advanced disease develops, and so stem cell research, targeted therapies, and genetic implications are all very important.
We've seen dramatic progress in the area of gene therapy. A lot of great research presented here, and a lot of gratifying regulatory relief in terms of moving forward into patient trials for gene therapy. Stem cell therapy is a little further behind. But how do you see those two areas playing out as NEI priorities?
I think they're very high priorities in our Audacious Goals initiative, again, which Paul Sieving will speak about.
Excellent. Is there anything else you'd like to add?
I thank the National Eye Institute for all that they've done and for all the support that they've done for research over the years, and they're tremendous benefactor for what we do. So thank you.
Thank you, and thank you to the NEI once more. This is Dr. Dave Seftow reporting from ARVO 2014.